Hello, this is Eddie Garcia, Senior Vice President at Healthsperian, and this is For the Health of It. For the Health of It is a weekly podcast covering all things health policy, brought to you by Healthsperian, a nationally recognized health policy consulting firm focused on federal and state regulatory and legislative analysis, advocacy, and business strategy. On this week's episode, we'll be speaking to you as the leaders of the Coalition to End Social Isolation and Loneliness, and we'll be joined by two national leaders on eradicating social isolation and loneliness. One, as the premier academic voice on the prevalence and impacts that the epidemic has had in burdening all ages of Americans, and another from the head of a dynamic startup which facilitates a real-world solution for both young and old. Thanks for joining us. Up first, your weekly Healthspiration, a moment to reflect on the bigger picture.
This is Tom Kasumbas, founder and president of Healthsperian. Even before the COVID-19 pandemic, our nation and those across the globe suffered from a silent epidemic, social isolation and loneliness. In 2019, over 60% of all Americans reported feelings of loneliness. And now, with the onset of stay-at-home orders, nearly 3/4 of Americans are suffering. Research has shown that loneliness significantly increases risk of poor physical and mental health outcomes, a 50% increased risk of death in older populations, and it costs our health system billions in potentially avoidable spending each year. In his recent book, Together, The Healing Power of Human Connection in a Sometimes Lonely World, our 19th Surgeon General of the United States, Vivek Murthy, said it best. We all have a deep and abiding need to be seen for who we are, as fully dimensional, complex, and vulnerable human beings. We all need to know that we matter and that we are loved. These are the deep-seated needs that secure relationships, satisfy, and when they are met, we tend to live healthier, more productive, and more rewarding lives. When they go unmet, we suffer. Social isolation and loneliness is real. Social isolation and loneliness is devastating. Social isolation and loneliness is a major burden on our health system. We need to finally acknowledge its impact and work together, all of us, to overcome this serious issue.
Now join Healthsperian policy experts and friends for Stay in the Know, a weekly policy segment on the top health policy issues we're facing this week.
Hi, this is Andrew McPherson, managing partner at Healthsperian here in Washington, D.C., and this is Stay in the Know. Today, I had the pleasure of speaking with Dr. Julianne Holt-Lunstad, professor of psychology and neuroscience at Brigham Young University in Provo, Utah, as well as Andrew Parker, the founder and CEO of Papa Pals, a startup company based in Miami, Florida that pairs older adults and families with volunteers for companionship and assistance with everyday tasks. In our conversation, we explore the prevalence of social isolation and loneliness in America, both prior to COVID-19 and the subsequent increase we've seen as a result of the pandemic. We also discuss potential interventions to address the crisis, as well as a range of policy solutions that Congress and the Trump administration should consider to support individuals who are socially isolated and/or lonely. Thanks for listening. Well, Dr. Julianne Holt-Lunstad, professor of psychology and neuroscience at Brigham Young University, and Andrew Parker, founder and CEO of Papa Pals. Welcome to For the Health of It and Stay in the Know.
Thank you.
So I want to start with you, Dr. Holt-Lunstad. Obviously, social isolation and loneliness were just major issues in America prior to the pandemic. Can you just start off by describing what we know about the extent to which Americans are isolated or lonely, or both, prior to the pandemic, and define those terms for our listeners?
Yeah, so I think before we dive into the prevalence, it's important to know the difference between isolation and loneliness, because they're terms that are often used interchangeably. And For many people, they co-occur. Being isolated and lonely coexist, but they can be distinct. So social isolation is generally thought of as having few social connections, infrequent social contact, or infrequent social participation. It's generally thought to be much more objective than loneliness, which is thought to be more subjective, or feeling isolated or feeling alone rather than being objectively alone. Loneliness is often described as the discrepancy between one's actual level of connection and one's desired level of connection. So someone could be socially isolated and not feel lonely. They may take pleasure in being alone. And conversely, people can be surrounded by others and still feel profoundly lonely. We often hear the term lonely in a crowd, or someone might feel lonely at a party. And so these examples give that distinction between the two. But for many people, being alone makes you feel alone. And so they can co-occur. And in fact, many of the indicators of social isolation increase your risk for loneliness. Your other question was then, well, just to what extent does this impact the greater American population? And the hard part about loneliness is that it has not been routinely collected in the population. So we do have some nationally representative samples that help us estimate that. And before the pandemic, these estimates ranged anywhere from about 22% to over 50%. And then, of course, there are indicators of social isolation. So some are routinely collected in the census. So, for instance, indicators such as living alone, more than a quarter of the population lives alone, although, of course, you can live alone and not be lonely. It's just one indicator, of course. But there's surveys that suggested that the size of people's social networks have shrunk, as well as fewer people participating in social groups. And so, of course, what these surveys suggest is that a significant portion of the population, even if we go by the most conservative estimate of 22%, that's still a significant portion of the population that was already feeling isolated or objectively isolated or lonely prior to the pandemic. And some recent surveys suggest that this has increased anywhere from 20 to over 50%. That's an increase from existing levels. Mm-hmm. So what was already a significant portion of the population affected by isolation and loneliness has now been exacerbated significantly.
And Andrew Parker, are you seeing similar numbers with the population that you serve? And is this the type of data that Papa Pals is working with as well? Tell us about your experience.
Yeah, so Papa connects older adults and families to companions. We call them Papa Pals. They provide companionship, assistance, and transportation, like a family on demand. And, we've always been a company that is at our core companionship, serving lonely and isolated, some of which can be lonely, some could be isolated, some could be both. But the fact is today, most people in the world are isolated. Everyone on this podcast are, I assume in their homes with their families, away from others, not at their office. And so the fact that that's not only impacting, which has historically been negative to the health of an older adult, is now really impacting everyone. In fact, I think it's more eye-opening than ever to understand, wow, this is how maybe people have been feeling this whole time. I understand that. Me personally speaking, I don't feel alone per se. I am technically isolated, but I could just imagine being an older adult who maybe doesn't have that much family near them on a typical basis, doesn't really know how to engage in the world the way that maybe we do. It could really be negative. And so Papa has released our newest platform, which is virtual companionship, and we provide assistance from a distance. But we'll do things like go grocery shopping for an older adult. We'll go to the pharmacy and pick up their medicines. We'll drop those things off in a contactless fashion, but these people are still isolated. They're still lonely, and so we have to be able to connect with them. And so we've started to spend a lot of time with older adults today because of COVID over the phone and over video. It's been really impactful. It's interesting because for us, for the first time ever, we're able to understand what's going on like in real time in that visit, because these are something we can monitor. Before, of course, we knew what was going on, but for us to be able to understand at the deepest level what's going on in these people's lives and how this time period's impacting them, but also just being an older person and what that means to them specifically. It's very nuanced. And I think, the rest of us now recognize, obviously on this phone, always understood about the impacts, but the rest of the world is saying, wow, loneliness and isolation, those are actual problems.
Yeah. And question for both of you, and we'll start with Dr. Holt-Lunstad. There's an extraordinary amount of stigma today still around a range of mental illnesses. Certainly that's no different for social isolation and or loneliness. Do you think that the pandemic has helped to normalize, if you will, loneliness and isolation or not?
So I think what we're seeing right now, and of course, as things are evolving, we need to continue to monitor this, but what we're seeing right now suggests that may be the case. So one of the statements that you made about stigma is absolutely correct in the sense that there has been a lot of stigma around social isolation and loneliness in particular. And in fact, research has even shown that when someone is identified as lonely, others don't want to be around that person. They are less likely to want to engage with that person, which actually makes it even harder to address this. Admitting that you feel lonely has come with this attachment of that you're somehow a social failure. Instead, I think what we're seeing is that, and first of all, the research shows that all of us feel lonely. Loneliness is an adaptive response because we're social beings. We are meant to be with others. It's like hunger or thirst. It's this biological motive that motivates us to reconnect to others. And so this is something that's absolutely normal and adaptive that we all feel to some extent or another. And so it's not something that we should feel ashamed to admit. Mm-hmm. And I think now that we are all facing the social isolation of stay at home or quarantine or social distancing, because it is affecting us all, I think it's much easier to admit. And 100%. We can really have more of this shared experience that people feel much more freely willing to talk about.
Yeah, I mean, generally speaking, people don't want to admit they're lonely. It is a weird thing to kind of say. And if you think about pop-up, most of our business goes through insurance carriers as a benefit like Humana. We just, announced the Far From Alone campaign, which has been really impactful to drive awareness. But, a lot of interesting aspects about the fact that people are now willing to say, you know what, I am lonely, because everyone else seems to be kind of feeling some type of impact, not maybe specifically the same as I am, but I feel more comfortable telling people. And what's nice is we form a bond between a pop-up pal and a member. And the members historically have actually felt more comfortable with a pop-up pal than they would, say, their health insurance company or maybe their family, because this is like a family on demand, but this allows them to actually build a new relationship with the person where they can say, you know what, I am lonely. But, because Papa is mainly going through insurance, before it's not like people would Google, I'm lonely, can I talk to a Papa pal?
Right.
So we don't always start off with that type of interaction. What we start off is, we're just here to help you. You need help with grocery shopping, you need help in the home. And then over time, that person starts to use Papa more and more. And, it's only so much that errand-wise that you need to be done. And it's obvious that it's companionship. So before COVID, people wouldn't as much say, and they're saying it more now, but they've always acted in a way that showed that they see the value in the companionship pieces.
I think one significant misperception about social isolation and loneliness is that it just occurs in senior populations, but that younger people are as lonely and sometimes more lonely. Andrew, talk about the impact on the younger folks that you're working with who are, connecting with older folks and what impact that has on them as well.
Well, according to a Stigma study that's been done, I think this is the third year, from my understanding, of determining loneliness across the population. And they actually found, to your point, that younger college-age individuals are more lonely than older adults from a statistical perspective. It may not affect their health as much because they still may be able to drive to the doctor. They still may be able to take care of that. But over time, there's a huge impact. And what's interesting is we originally thought of Papa to really help the older adult. But what we find is the amount of stories and knowledge and information that they could pass down to the younger generation. I mean, pairing a senior, who was working at Disney World 50, 60 years ago to a Papa pal that works at Disney now as an intern, is also doing Papa Pal on the side. It's a very interesting opportunity for this older person who is lonely possibly and is isolated possibly, but wants to be able to pass on their knowledge to a younger Papa Pal who also may be lonely. I think about my own siblings a lot. I have a younger brother who's 20. He gets along better with 80-year-olds than he does with 20-year-olds. And so for him, I do believe that it would be impactful to be able to, access that service. So loneliness affects people. And we really think of Papa as a platform that's helping people, connecting them to people that want to provide help. And right now, loneliness is that key factor to older adults. But that's the big reason we transition from grandkids on demand to family on demand, with the vision of helping more than just seniors.
As you said, surveys are showing that this also affects younger populations, particularly Gen Z and millennials. And this has been shown in that Stigma survey as well as other surveys, and has been shown internationally. And so one of the reasons that it is perhaps behind that is that also when you're of that age, there is the norm of or expectation that your social network should be expanding at this point, right? And if you think about the definition of loneliness, it's that discrepancy between one's actual and desired level of social connection. That perception can be altered based on those expectations, which also can be fed into by a number of outside sources, including social media. Another point that I wanted to really add upon there is what they're doing with the younger and older adults is there's research to suggest that providing support to others can have just as much, if not more, of a benefit than receiving. And so oftentimes what we find is by helping others, we're actually helping ourselves. It's a great model to work off of.
Yeah.
Excellent. I want to go back to this notion of social failure. What a powerful term, Dr. Holt-Lunstad. Talk a little bit more about that. That's the first I've heard that phrase. And I think we tend to think about loneliness as an isolated, pardon the pun, experience, but it has tremendous health impacts well beyond our mental health. And that's been proven. Can you walk us through that a little bit and what that looks like? And then, Andrew, I'd love to hear about how your model addresses some of those issues.
Yeah, so, throughout human history, we've needed to rely upon others for our ultimate survival. Humans are the most vulnerable species at birth. We would not survive if we were left on our own. But of course, this is true throughout our lifespan. And again, throughout human history, we needed to rely on others. Being part of a group provided protection, safety, efficiency of effort, and being on the outside of a group is really vulnerable. Mm-hmm. And so what neuroscience has shown is that our brains expect proximity to others. And when we lack proximity to others, particularly trusted others, this creates a sense of heightened alert. So not only in our brain do we use more metabolic resources, but this signals parts, the rest of our body, and that can put us in this state of alert to deal with whatever threats we may need to, or challenges we may need to face on our own, right? Facing a challenge on our own is much more difficult than being able to rely upon others. What research has shown is that this is associated with heightened blood pressure, stress hormones, inflammation, a variety of physiological markers. And if experienced chronically, these can put us at increased risk for a variety of illnesses. If we think about inflammation alone, inflammation has been implicated not only in major chronic diseases, it's been implicated even in depression, also in cognitive decline. And so this might help explain why we have very robust evidence that being socially isolated and lonely on a chronic basis leads to increased risk for heart attack, stroke, type 2 diabetes, cognitive decline, as well as increased risk for premature mortality. So data from my research, we have data from over 3.4 million participants worldwide. And what we found was that loneliness predicted earlier death by 26%, social isolation by 29%, and living alone by 32%. But the good news is that people who are socially connected in a variety of ways, from the size of their social network to perceptions of support and social participation, being socially connected increases our odds of survival by 50%. So being socially connected has a very powerful protective effect.
And so I assume, Andrew, that's what Papa Pals is going for, is developing and that social connectedness. Talk a little bit about that.
Exactly. What's interesting about the time period we're in right now is it almost allows everyone to experience something very similarly together. And I think that's really impactful. Part of that goes toward that stigma piece, but also about allowing people to connect in ways that they maybe wouldn't have before. So today we're doing a significant number of virtual visits on a daily basis where we're literally calling older adults, connecting them to Papa Pals, and then we're actually transitioning them to video. So what's happened because of this time period are people saying, maybe I do want to talk to someone on the phone, or maybe it would be helpful for me to feel more connected. So it's almost like the members themselves, which today are mostly older adults, are saying, this is important for me. In fact, about 20% of our customers that opted out of in-person services, because people opt out and in for a variety of reasons, opted back in because they were actually realizing, maybe I don't need to be so prideful about this time period I am in, and it's very important for me to be connected to someone. And then the relationship that's built over a phone call or over a video interaction is pretty amazing. And you hear some things that are pretty funny, joking about toilet paper, joking about different things that have impacted them specifically. But then you also hear, a Papa Pal helping an older adult not only feel comfortable during COVID, but also get them their medicine. So there's so much nuance about this where someone who maybe before, I don't believe many of these older adults before would have said, let me do a telemedicine visit. Let me do a virtual companion visit. Let me do a telephone call with a younger person. But now they're saying, you know what? Everyone's isolated now. I feel somewhat lonely. I'm willing to say, let me talk to somebody that may bring value. And the amount of testimonials we have from the older adults is amazing. They just really love it. They just love someone that they could talk to and connect to in a way that they really didn't feel comfortable doing before.
Yeah, so I guess that's what I want to drill down on a little bit. We've talked about the prevalence. We've talked about that there's interventions that work. But let's really think about how the impact on the healthcare system overall. I think that's really interesting that you're seeing an uptick in telehealth or telemed visits. But Dr. Holt-Lunstad, can you talk a little bit about the impact on the health system? So if we get this right, let's say that Congress, for example, or the administration acts on some major policy initiatives to support individuals who are socially isolated, lonely, or both. What would the impact on the health system look like? Can we provide higher quality care, more coordinated care? What does that look like?
Yeah, so first of all, it's really complex because one of the things that we're struggling with right now is we're in a situation where in-person kinds of contact is limited, right? And so we're doing the best we can with these remote kinds of approaches. And one of the things I just want to make sure that we're careful about is that we know much less about distance kinds of and remote kinds of approaches. And so just to put this into context, one recent survey showed that video kinds of conferencing showed reductions in loneliness for 40%, which is fantastic. But for 50%, it made no difference in their level of loneliness. And for 10%, it actually made it worse. We really need to understand what kinds of methods work best for whom. And so I think that this is a broader issue. And I served on a National Academy of Science committee that issued a report around the medical and healthcare relevance of social isolation and loneliness. And this report was specific to those over 50. But of course, this, I think, and my data suggests is that, of course, may impact people of all ages across the developmental span. But there's important healthcare policy relevance to this. And one of the conclusions that we drew from this consensus report was that because there are multiple underlying causes of social isolation and loneliness, one size fits all approach is likely to work. And that we really do need to make sure that we have efforts that are sensitive to the needs of the individual. And this is an approach that's across sectors. So certainly government plays a role, individuals play a role, neighborhoods play a role, communities play a role, healthcare systems play a role, for-profit and nonprofits play a role. We really need to address this issue across these different stakeholders to really have an impact. I could go on and on about potential policy.
Sure. I think that's one thing that we found. We lead the Coalition to End Social Isolation and Loneliness here in Washington. And when we worked across stakeholders that participate in our coalition, community-based organizations, mental and behavioral health community, some of the major health plans, what we found is that the intervention here is likely not a healthcare or a medical care intervention necessarily. It's really more of a social determinant of health or a social intervention, community-based intervention when you're thinking about policy solutions. So completely understand that. Andrew, talk a little bit about the impact on the healthcare system. If we get this right with your model or models similar to it, are we going to save money and provide higher quality care? What does that look like to you?
I agree a lot with what's been said. And then just generally, prior to POP, I was an early team member of a large telehealth company called MD Live. And we always thought about telehealth as being a component to a larger picture. And to your points, there's not really one size fits all solution to be able to support people, both with loneliness and isolation, but also with healthcare needs across the spectrum. And so the way I've always thought about healthcare is it has to be really virtual and in person based on the need of that person, whether that's a young, fun person coming to hang out and drive you to the doctor or do an interaction with you over video or telephone, or on the more higher acuity spectrum, it's a follow-up specialist physician doing a telehealth encounter, post-surgery, for example, or to manage diabetes. So I think it's just dependent on both the person and the need. And the way we think about healthcare, I've always thought about healthcare as virtually and in person, and also best resource management. So a pop-up pal could do a lot of things that a nurse can also do, but should a nurse be running errands for an older adult? And should a nurse be there talking about their life and playing a game of canasta? Or should the nurse be operating at the top of her or his license to be able to support that member with those things that are more specific to their category? That's how I look at everything. I'm a founder of a startup company, optimizing efficiency and using the best people for the biggest need at that particular time.
Sure. I want to stick with this policy thread for just a moment. Here in Washington, as you know, the Congress has now passed 3 really significant pieces of legislation to address the COVID-19 pandemic. They spent over $4 trillion, more to come. There'll likely be another, the House Democrats just passed on Friday, another major stimulus package, but also that has a ton of healthcare components to it. What should policymakers be focused on here in Washington to address the crisis of social isolation and loneliness? What's your recommendation, Dr. Holt-Lunstad?
I've actually written a couple different papers now that address some of the public health policy implications of social isolation and loneliness. And one of the things that I think may help kind of just sum up this is, the World Health Organization, and I believe the CDC and other major health organizations have adopted a framework of health in all policy. And one of the things that I argue, and of course, social should be part of that, but it's not explicitly recognized to the degree it should be. And so if we think about social in all policy, the recent pandemic, of course, really highlights just how profoundly being social is connected to every aspect of our lives. The way we work, the way we go to school, the way we shop, the way we live, because we've seen how it's drastically changed our lives, right? So I think that this is an opportunity to really recognize just how important our existing policies have on the extent to which they either create greater distance socially or foster social connections. And if we can start by looking at our existing policy and find ways to, of course, in this pandemic safely, but in longer term planning, look at how that affects us socially. And then think about across all of these sectors, how we can develop policy that will foster greater connection and alter the kinds of policies that may have unintended kinds of effects that create greater isolation.
Andrew Parker, do you agree? And what would your recommendations to the Trump administration or the Congress be?
I think about it more generally a little bit than anything. I'm not into the weeds of the policy, but how I think about it generally is I think this is an eye-opening moment for policy makers and leaders and those that are part of this process to just say, there's things that should be changed. It took us 15, 20 years to get to some of the policy changes around telehealth. which I think is some of the most positive impacts so far. And maybe that will open up the eyes to other things like loneliness, like social isolation, like how to care for people in different ways, always on a nuanced level. But I believe, this time has been positive from that perspective to really push policymakers and leaders to say, we actually should be making changes. And do we have to spend 20 years making these decisions? And can we do these things now to support people now? And, I do believe this is going to be positive for both sides of the aisle.
Well, look, Dr. Julianne Holt-Lunstad, professor of psychology and neuroscience at Brigham Young University, and Andrew Parker, founder and CEO of Papa Pals. Thanks so much for joining us today.
Thank you.
And here is our industry foresight.
Hello, this is Jean Dessau, Senior Partner and President of Healthsperian X. I want to talk today about the potential for technology to reduce social isolation. We've heard from several experts in this podcast today about how we as a society can help seniors and others who are suffering from social isolation, particularly during this challenging time of the pandemic. As we open, we're really going to need to keep at-risk older populations in more isolated settings than we otherwise might to protect them from disease transmission. Connecting with loved ones, of course, is a really important activity to facilitate. And one thing we can do is use technology to advance channels that can help people who are isolated connect with their loved ones more effectively. One of the important factors that can support this is ensuring there's better broadband and IT support in nursing homes and in other home care settings where our senior populations may be isolated. Online communication is also a very important and vital link for people, as well as helping them connect with meaningful activities. There's a real need to find a way to get better IT support functions to help seniors engage and leverage all of these technologies. Resources like podcasts also can help entertain and reduce the impact of isolation. But again, there's a need for a personal touch, albeit remotely, and tech professionals can help enable this. Concerns about physical connection are really going to still remain no matter the technologies that we deploy. One thing is that pets have long been an important source of affection for seniors and for people that are isolated. And there's a really interesting trend in the development of animatronic pets, robots, which may be able to offer solace in the future to senior populations. Combined with remote monitoring tech, families can better identify when problems are arising. So technology can really advance how we help people who are perhaps physically isolated not be socially isolated. But as we do so, we can't forget that many people don't have families. And for them, isolation and the type of isolation we're facing now during the pandemic can be extremely painful. People living in poverty and with disability also need sources of a connection to the world. And this is an important area for innovation in the future. Tech alone won't solve isolation and loneliness in aging, and it won't replace the human touch. Assistive robots, animatronic pets may help the burden, but they don't get to the core of people's challenges with aging. I think we really need to focus on how we can use the tech in an integrated way with appropriate supports to really get to what I might call successful aging for our seniors. Thank you very much. I appreciate the time today.
For our last segment, here is our outlook for the week ahead.
Hello, my name is Melissa McHale. I'm a health policy analyst at Healthsperian, and I'm going to give a quick breakdown on what to see coming up in the week ahead. So we're seeing a shift in the regulatory as well as just the general dialogue nationally, shifting towards strategies to reopen as we're starting to see states are moving towards reopening local businesses and economies. For instance, we saw the CDC released guidance on how to implement a phased reopening. Much of this new guidance includes an overview of very critical public health measures that public health experts have agreed were critical mechanisms to have in place for reopening. The big one being testing, which will be aimed at tracking the virus's spread, and this guidance will also be used to help state and local governments when they are making decisions to respond to this reopening. The final 20 pages of the guidance lays out specific stages for reopening childcare programs, schools and day camps, companies with high-risk workers, as well as restaurants, bars, public transportation, things of that matter. The document also gives detailed suggestions for social distancing, best hygienic practices, as well as how to be aware of specific symptoms of COVID-19 and how to react accordingly to those symptoms. To follow up with that, we also saw that CMS released companion guidance that was similar, recommended practices for nursing homes as they begin to reopen. As we know, nursing homes has been very much a source of infectious spread of COVID-19. So there has been additional guidance put in place on recommended best practices for nursing homes. So we're seeing a bigger shift here towards having more precautionary guidelines as well as other vehicles in place to reinforce testing. Again, back to testing, HHS recently awarded $225 million to rural health clinics to help them get their testing mechanisms put in place. This was announced last week as well. The funds will be divided among 4,500 clinics across the US, which will be used to implement testing programs, buying testing supplies, training staff, things of that matter. So we're starting to finally move towards a larger testing strategy to reopen. The question now, however, is whether these practices and precautions will be enough to minimize any rises in cases. So that is something that we will be on the lookout for in coming weeks as local businesses and economies start to reopen again. Now, on to Congress. We saw last week that the House passed their fourth legislation, which would have encompassed $3 trillion in additional funding to state and local governments, to hospitals, to unemployment benefits, as well as direct stimulus payments to Americans. That was passed in the House. There has been a consensus among the White House and the Senate that they will not take on the legislation. And President Trump even so much said that he would veto it if it were to come to his desk. So now we're at kind of a standstill with Congress. Senate Majority Leader Mitch McConnell vowed that he will not extend enhanced unemployment benefits in the next coronavirus aid bill. He also told House Republicans that he is kind of comfortable right now just taking a break with executing any future stimulus legislation. He conceded that more relief may eventually be necessary, but that if so, it wouldn't be as robust as the $3 trillion package that the House had passed. McConnell also signaled that he would insist on liability protections for businesses, which would aim to shield corporations from coronavirus-related lawsuits. This is, again, something that Democrats have also pushed back on. So we may see a bit more of this standstill with Congress for the foreseeable future until we really see a consensus on future legislation. With that said, though, Congress is still also functioning in an oversight capacity. We've recently seen a few hearings related to the execution of the CARES Act from the Treasury, as well as the implementation of the Provider Relief Fund. So Congress is trying to do its best to keep oversight of the stimulus that has been executed in previous legislation, Families First and the CARES Act. But we are going to probably continue to see some standstill between Senate Democrats and Republicans for some time. So I talked about Senate Republicans. Senate Democrats, meanwhile, are pushing another rescue package. They're currently in discussions debating on how to secure more aid for cities and states, as well as how to extend enhanced unemployment insurance benefits. Economists have warned that if we do not have some mechanism of that in place, more jobs will be lost or will remain lost. Basically, there will be long-term economic damage. So that's currently where we are with things, and that's everything you need to know for the week.
That concludes our episode for this week. Thank you for tuning in. If you have any questions on anything you heard on this week's episode, please head over to healthsperian.com for more information and deeper analysis. And as always, tune in next week for more health policy insights and discussion.